Hello guys, today our topic is cytomegalovirus. Cytomegalovirus infection is a common hypervirus infection with a wide range of symptoms, from no symptom to fever and fatigue, resembling infection mononucleosis, to severe symptom involving the eyes, brain, or other internal organ. This virus is spread through sexual and non-sexual contact with body secretion. Most people have no symptom, but some feel ill and have a fever, and people with a weakened immune system and have serious symptoms. Cytomegalovirus can cause serious illness in infants who are infected before birth. Doctors may detect the infection by culturing a sample of infected body fluid, such as urine. Often, no treatment is required, but if the infection is severe, antiviral drugs may be used. Infection with cytomegalovirus is very common. CMV is a type of hypervirus. Blood tests show that 60 to 90% of adults have had a CMV infection at some time. CMV may cause symptoms soon after infection. Also, it remains dormant, inactive in various tissues for life. Various stimuli can reactivate the dormant, so CMV resulting in virus growth, which can sometimes cause disease. The lungs, gastrointestinal tract, brain, spinal cord, or eye may be infected. Usually, CMV infection causes no symptom. Serious infection typically develop only in infants infected before birth and in people with a weakened immune system. For example, people with AIDS or those who have received an organ transplant. In people with a weakened immune system, disease often results from reactivation of the dormant virus. Transmission of CMV. Infected people may shed cytomegalovirus in their urine or saliva intermittently. The virus is also excreted in mucus in the cervix, the lower part of the uterus, semen, stool, and breast milk. Thus, the virus is spread through sexual and non-sexual contact. If a pregnant woman is infected, the fetus may acquire the infection during the pregnancy, or the baby may acquire the infection during delivery. CMV infection may develop in people who received a transfusion of infected blood or an infected organ transplant. People who have received an organ transplant are particularly susceptible to CMV infection because they are given drugs that suppress the immune system to prevent rejection of the transplant. Most people infected with the cytomegalovirus have no symptoms. A few infected people feel ill and have a fever. Infection with the CMV, like that with Epstein-Barr virus (EBV), a type of herbivirus, can cause a type of infection mononucleosis in adolescent and young adult. Both CMV and EBV mononucleosis cause fever and fatigue, but EBV also causes a severe sore throat. CMV does not. An uninfected person who received a transfusion of blood containing CMV and become infected can have a fever and sometimes liver inflammation develop 2 to 4 weeks later. In people with a weakened immune system, CMV can cause serious disease or death. In people with AIDS, CMV infection is a common viral complication. The virus can defect the retina of eye. This infection can cause blindness, infection of the brain, pneumonia, or painful ulcers of the intestine or esophagus may also develop. If a pregnant woman transmits CMV to the fetus, the following may result: miscarriage, stillbirth, death of newborn. In newborn, CMV infection may cause extensive damage to the liver or brain. Newborns who survive may have hearing loss and intellectual disability. Thank you.